abuse, cancer,
measles, diabetes.
Good evening once again, and welcome to another Doctor on Call. It is a pleasure, as always, to be here with you and, of course, to share information with you, as we always say, that can help to improve your wellness. And of course, we all learn. Dr. Nixon is with us as always, and it's always a pleasure to have her. So we welcome our viewers on GBN Television 7 and 11, our friends on our Facebook page and YouTube channel, and our listeners on K105 FM. Thank you for joining us. And hey, we've got some great information to share with you this evening. This evening, we're looking at respiratory diseases. Yeah, just some of the common ones, and we're going to look at them and, of course, share with you how you can prevent, and, of course, in the event that you do pick up one, how you deal with it in terms of treatment and all of that. So it's a good time to welcome Doc. Doc, good evening. It is good to have you back. How have you been?
I have been quiet. Had a very quiet Independence weekend. I know people had great times. We've had one very unfortunate situation this weekend. And maybe I'll talk about that a little, where a young lady was murdered, allegedly. So that was very sad for me to get up and hear this, that a defenseless young woman was, attacked and killed by someone who the police, thank you very much, RGPF has since apprehended.
And charged.
And so I want to extend my condolences to her family, her parents, her siblings, the people who she studied with, the people in her community, and other relatives, and to Grenada as a whole. We don't want our women to be mauled by anybody, especially by our men. So I'm really very sorry that this young lady has lost her life in such a horrible. I don't want to imagine what has happened before. So we send out our condolences and our support and all our love and comfort to her family. Must be a very difficult time.
Yes, indeed. It was quite.
But Independence was shocking. Nice, and also, so I'm going to do my usual thing. You can't stand this. Did you see them convent girls?
No, I did not. I didn't.
My God. Convent girls should put that in a pan and sell it March past.
Actually, I stayed home all day. I did not go anywhere. I stayed home and I rest.
I didn't go anywhere either.
And I did have some oil down. I made myself a little oil down, and
somebody put oil on and gave me. Thank you very much.
It was quite good, even if I say so myself. It was really, really good. In fact, I have oil down to last me. I would say today is Tuesday, up to about Thursday. So
because you can't get nobody that, because you're not going to say it's very good.
No, let me tell you something, Doc. As far as I'm concerned, the best oil you can eat is a stale one. When it's stale, that's when it's nice.
I know, because I had mine Saturday and Sunday. I was having my lunch at 10:30 a.m. on Sunday.
Stale oil, Doc. I mean, once it's well refrigerated, and it's the best oil. The flavor comes out. The longer it stays. It's like how that nursery rhyme go? Peas porridge hot, peas porridge cold.
Peas porridge cold. Peas porridge in the pot 9 days old.
Yeah. Well, right. Nice oil, Grenadian oil is like that. Yeah, definitely. But Doc, this evening, we want to talk about, of course, respiratory conditions. And it's very common now because you move around and everyone seems to have the cold or the flu, whatever it is. Coughing, a little runny nose. I've heard some people complain about little body aches, a little fever, things like that. So it's quite common now. And so I think it's quite timely that we, share some information. Information that is how we can protect protect ourselves because, of course, the protection methods are there, the protocols are there, so to speak, and we just need to remember what we need to do. In fact, some of the things that are required to prevent it are things that we should be doing normally. Would you agree, Doc? Right.
Yeah, well, COVID taught us that if we didn't learn the hard way, we're going to learn harder ways, because nobody wants to be sick. Those of us who survived COVID, whether or not we were vaccinated, are lucky to have done so, because COVID had a very high fatality rate.
Indeed.
So, a lot of us say, I have a cold and your nose running for 3 weeks. That is not normal, that you have runny nose for 3 weeks. And we tend to forget the great thing of just having allergies or sinusitis that's related to allergies. So what do you get when you have allergic problems? It's usually dust in the air, some particles that you're inhaling that cause your mucosa, the lining of your nose, your throat, to kind of respond a little, acutely. And it's all with intentions of protecting your body. This thing that comes in, let me wash it out quickly. And I remind people of COVID. You remember how we talk about people drowning in their secretions? That was part of the body's normal response. It was just exaggerated. So people had a lot of fluid in their lungs and everywhere because of this strange virus that came in and really caused a lot of irritation and etc. Right? Because it caused internal bleeding, it caused a whole lot of stuff, right? Because a lot of people died because their kidneys failed, or they died because they had many strokes, right? Because this virus was just without limits. But the allergies, you kind of know what you're allergic to. A young mother called me recently that, she was concerned with her daughter, that her eyes were swollen, that she was itching her nostrils, blah, blah, blah. Look out the window, first of all, when that starts happening, especially if it happens in seasons. What is flowering? Might be a cherry tree, right? That's you're allergic to the pollen from the cherry tree. Mango flowering now, so it might be that mango tree that's closest to your bedroom. Once you open your window in the morning, all of this pollen comes in on you. It could be something that you're allergic to, okay? So look out and see what could it be. Could be something you're eating, okay? Could be, things going around and you get like a virus, but allergies are something we have. You don't want your allergies to be prolonged, to stay too long. So you kind of need to find a way to do it. Normal saline solution will wash your nose out, and you're not going to rub and break up the mucosa and allow bacteria to pass and cause you to get things, to get severe infection, and same for your throat. A lot of people, when their sinuses get inflamed because of allergies or bacteria, have postnasal drips, so you cough, cough, cough in a rhythm. And literally, you could say, okay, I'm going to cough now because I coughed 20 minutes ago, and 20 minutes after you cough. And that's a time when the little hairs in your sinuses and your nasal passage tend to sweep out whatever is there. So it happens on a rhythm, like on a clock, right? So you have that cough. You lie down in the night and the cough will start because all that secretion from your sinuses dripping into your chest. If that prolongs, sometimes you get lower respiratory tract infection. I was telling you about the lady with her daughter. They had a glory cedar tree. There's also glory cedar tree flowering now, right? Mm-hmm. And there's quite a few glory cedar tree on their boundary. And that is what the child was allergic to, right? And then she takes her hands with all this pollen and rubs her eyes, right? And I had to say, I just want you to wash your hands often. Wash it with water, don't use sanitizer. Water. So whatever is on your hand doesn't get into your eyes. She settled down with a little bit of antihistamine. By the end of the day, she was a lot better. But she was already getting wheezing because it had been going, and all the secretion going on her chest can make you get a little bronchitis. So you kind of need to figure out what it is I'm allergic to in my environment, what's making me not do very well. So I have the runny nose every day. And if it happens seasonally, think that it just may be allergies, okay? And I think I'm going to jump to asthma, because although asthma is not a disease, an infectious disease. It's a chronic disease, and asthmatics know that they're asthmatics. Family, and in families, okay? It runs in families. So if your auntie or your granny or your mother or your father has asthma, there's a likelihood that you too will get asthma. What is asthma? What happens when you get an asthmatic attack? Your body responds in an exaggerated fashion. Like I tell you and I walking down on dusty highway, and the dust blow, and I'm the asthmatic. You're fine. You cough a little bit, so just to get rid of whatever irritation is there, which is part of the body's normal response. But no, not me. I start coughing, I cough, and I cough, and I start wheezing and having shortness of breath and stuff, right? Because my body responds in an exaggerated fashion to whatever it doesn't like, per se, right? You should know, mothers should know when they're trying to have asthma. Asthma also is a disease of the night. It starts with coughing, right? It starts with coughing. And if you haven't coughed just in the night, you kind of need to wonder. And then you can actually hear the child wheezing, especially when they're breathing out. That sounds like a cat. Remember, big grandma tell you wheezing like cat, right? That is one of the symptoms, and it means that the airways are so closed so tightly, because that's one of the things that happens, that the child has to force to breathe out. Breathing in is easy. Breathing out is usually just breathing in. You use your muscles, but to breathe out, it usually happens spontaneously. The muscles relax anyway, but not with asthma, because your airways are closed. You breathe in, and you use your muscles as normal, but when trying to breathe out, all this air kind of stays back. You have difficulty to expire, and it becomes very difficult. But what happens when you have asthma? Like I said, first of all, whatever it is that's going to trigger off your asthma, there are many things. In our case, we talked about cockroach urine. Remember that? Mm-hmm. In poor environments, if there was a cockroach, the urine would make you. But there are other things that to trigger off: dust, smoke. That's why we shouldn't smoke around our children, especially kids with asthma, and that includes smoking weed. Thank you, people. So this thing, whatever it is, irritates the respiratory tract, especially the lower respiratory tract, the bronchi and the smaller bronchioles, okay? And there's this response where, one, the muscles around the bronchioles constrict, so they close up the airway. Plus, you have when you have a cold, you say how the nasal mucosa, the lining of the nose gets swollen, your nose block up, say your nose cock up, right? In the same way, it's the same kind of lining. It responds similarly, so it swells. You get hypertrophy, we say mucosa, right? So the lining gets swollen, and then again it produces all of that secretion, except that secretion is very thick. And you see asthmatics cough and wheeze, and when they cough and they take up this thick sputum, just a little ball, like a pearl ball, they get relief, because the secretions are called thick and tenacious, very thick. So if your child is having an asthmatic attack, start giving him fluids, water, so that the secretions that he produces will be easier to move, right? Tapping him on his back. But you also have to give him his medications, right? As a matter of fact, because of that inflammation on the lining, we know that our children or patients, generally asthmatics, respond to the brown inhaler, the steroid inhaler, because it controls the lining, the swelling. So that's what's most likely there. The blue inhaler or the Ventolin or sometimes albuterol, whichever one you have. And some people have Symbicort, which has both a steroid and an expander for your bronchi, for your airways. Your brown inhaler you really should use every day. Your blue inhaler you use, it's called your rescue inhaler. So once you start wheezing, because you might not start wheezing on day 1 or day 2, but once you feel like you're having really difficulty in letting out air, or just even breathing in, you need to use your blue inhaler, your rescue inhaler. If you're using your medication probably 3 days for it, you need to go to the hospital if you're not settling down, okay? But you kind of need to know what asthma looks like, how far you will go, because people can die if they remain in status asthmaticus, which despite the taking their treatment, they're not settling. You need to go to the hospital, okay? We talked about how you get asthma, who has it, how you know, and usually, like I tell you, families will know. So there are other things that come with asthma, which is like eczema, right? And like a lot of dandruff, a lot of scalp, well, eczema in your scalp really, and stuff. Those are things that come and happen. And I want to remind parents that if your child has persistent eczema, you need to treat it, because the longer they have these skin conditions, the more likely it is. And if they have constant allergies and upper respiratory tract, the more likely it is that they come up with asthma. So if you control the minor symptoms, the minor related conditions, your child may not have full-blown asthma.
Right.
So that's asthma. All right. Right. And then, of course, there's things like, I want to talk about sore throat, because a lot of parents think that once a child has a sore throat, you need to get antibiotics, NO, because most of the seasonal sore throats and stuff that we get, even ear aches, ear infections, are viral causes. So you give the child medications for the pain and the fever, you make them gargle warm salt water, that kind of stuff, right? And that is what is really needed. No, if your child has persistent sore throat and you look in there and you see little things stick on, like when cuckoo remain in the pot, you have plaques along the back of your throat, then you worry. If the tonsils are very large and a child is likely to have problems with breathing, then you take your child to the doctor, and you may need antibiotics. But other than that, don't fight the doctor for antibiotics, because your child often doesn't need it. On top of it, we're trying to prevent antibiotic resistance, right? That we've used so many antibiotics that these germs know these antibiotics and already created their own resistance, put up caps around their bodies, and the antibiotics we have can't control them. And we haven't made any new antibiotics in donkey's years, so we kind of need to keep what we have for the stuff that we have. And we're already seeing that there's some diseases that resist all the antibiotics we have. So we have to be very cautious, okay? Especially not to use it injudiciously, all right? You don't need to use antibiotics if you don't need it, all right? So mothers, I know you're worried that your child has a fever and stuff. Keep the fever down, put a cold compress on his temples and his forehead, under his arm, around his neck. Sponge him down with room temperature water is okay. I don't know. I wouldn't tell people put ice water, because when you have a fever, you already feel so cold. I don't know why putting ice water could be challenging. You really want to decrease the child's body temperature, so you put it where you have, we have a lot of circulation closer to the skin, the temples. You do the forehead so that the brain doesn't get too hot, the neck, the armpit, the groin, and you can sponge them down slightly on the rest of the body.
Right.
Put on a little clothes. We tend to want to put on clothes, a lot of clothes on a child with fever. No. The less clothes, the better, because you want his body to cool down, right? And it is important that you don't put on too many clothes that will cause the temperature to remain high. And in children between 6 months to 4 years, they're prone to getting seizures, fits, as a result of the high fevers. So it's very important that we act early. And if a child gets repeated seizures, he can have damage to his brain. That's what fits do. They get brain damage from whichever part that stimulation is coming out excessively. Right. So it is important that we keep the body temperature down. Okay? Give him something cool to drink. All right? You don't have to give him hot tea. You don't have to give him hot nothing. Okay? And sometimes, he's not eating, but a child is going to eat when he starts feeling better, I promise you. And then you're going to have to go and steal out the whole food land, because you can't feed him once he starts feeling better. Okay?
I want to ask a quick question. I just want to just jump back to, you mentioned sore throat. Can other conditions, like other respiratory conditions, lead to sore throat? So apart from a child or someone just having a sore throat, could it also be a sign of something a little more acute?
Like measles, especially the child has a sore throat with measles, you worry. Measles, I think, would be what I'd worry most about. But you can have bacteria that cause sore throat. Mm-hmm. You can have viruses that cause sore throat. But I'm concerned about things like measles and sometimes mumps. Our children should not have those problems because our children should have measles, mumps, and German measles MMR vaccine, right? But those measles in particular, I know, does cause a severe sore throat, and of course the different forms of challenges. Now, in the past, we'd have children who would have sore throat from strep throat, right? That's what I told you. If you see a film, a whitish, creamy film on your child's throat, you go to the doctor. The advent of penicillin has been able to deal with that. In the past, when we didn't have penicillin or when parents didn't pay much attention to the child having a strep throat, it would stay. And the streptococcus, which is a bacteria that causes strep throat, can go down and damage the heart valves. Okay, to start with. Right? There are other things that can happen after, but you can get severe heart problems. A lot of people who have had heart problems, not born with congenital problems, could develop strep-related heart problems down the road, valve problems, and need surgery to fix it and be on penicillin for a whole long time up till 21 years old, you know. So it is important that we figure it out early so that our children don't have to go through life with things that we can fix.
Right. What about things like diphtheria and so? Can that also?
Yeah, but we don't have them. We're not supposed to have them things. Our children are vaccinated from diphtheria in their first year.
Okay. All right. Okay.
Right. And I'm glad to bring that up because, you know, recently there have been less acceptance of vaccines for our children. We really want to go back up to that 95% that we had. So just as you shouldn't have measles, you shouldn't have diphtheria. Diphtheria is whooping cough, okay? You shouldn't have that because you should. There's some populations where the grandparents come and they kiss the children on their mouth and all the crap, okay? And the children end up getting diphtheria and dying because these are young children whose immune systems are not quite developed. But if you keep them away from it and if they're not exposed to the virus, they're good, right? But diphtheria should not be happening in our population. So,
okay.
And why a child can die, is because we don't have that index of suspicion. We don't expect to see any child, right? Any baby, toddler having diphtheria because they should have been vaccinated.
Right. Okay. Lovely. So we do have some other common and I'm glad you started with asthma because it is a chronic condition and it can create problems, in a very, very short space of time. But the common cold, which is, the name is so perfect. It's very common. Let's talk a little bit about that.
Yeah, the common cold is just that. You have a cold. What you have, runny nose, itchy eyes, itchy throat, a little fever, your ear might hurt a little, you might have a cough because you have all of that secretions. It's just that. You might have a look with a joint pains, right? And that's because you have this virus that comes and knocks you. But if you have the common cold, usually the other people, and we see that especially in our schools, and especially in our daycare system, where the children don't have great immune systems. And whatever virus is going around, if we have 10 of us in a row, when Johnny gets it number 1 and I'm number 10, I get it. By the time I get better, Johnny have the second virus. Okay, that's what happens, especially when the seasons change. So soon when the so-called springtime, the rainy season starts, we're gonna have a lot of common cold. And it's just that, teach your children to wash their hands and to wash their hands before they eat. And if you're concerned in common cold season, make a child wear a mask. It works, okay? Don't share children like to share everything they have, and they can pass on the virus to each other. Teacher probably will get it too, but those are childhood diseases that we get mostly, And children get over childhood disease in a short time. You need to give them a lot of fluids. Like I said, they may not want to eat, but, you give them something for the fever, and you give them, they tend not to have pain. You might want to give them a little antihistamine if they get stuffy nose and stuff. But in 3 days, not more than 5 days, within 3 days, the common cold should go. If it doesn't go away, there's something else. Okay?
Right.
If it doesn't go away, it's something else. And sometimes, yes, we see different color snot coming out of the children's nose. Guess what? Sometimes we could have green snot. That doesn't mean they need antibiotics. That means that there are a lot of white blood cells that are going and trying to take care of it. All right? Mm-hmm. You're in your child starts coughing, and the cough sounds rattly on the chest, and they're having difficulty breathing. You watch it. But like I said, if you treat it early in the beginning, a virus is supposed to go away in 3 days. Lots of fluids. The more fluid a child takes, or human person takes, the quicker the virus will disappear from your body.
Right. So I want to make a comparison here. Someone who is asthmatic and picks up the common cold, compared to someone who's normal. In other words, someone who's not asthmatic. Should the asthmatic person be more concerned or take more precautions with the common cold?
Yes, it should be. Yes, you should be, because remember, you have all that irritation on the airways, and that can cause that exaggerated response. Mm-hmm. We have the airways shutting down. You have this, more swelling, more secretions, and sometimes, yes, a lot of times the common cold will trigger off asthma in the kids. That is why parents need to keep their medications at home. Make sure your child's inhaler is always there. Okay, the child gets a cold, you start work with it. Lots of fluids, right? Lots of fluids, and it just might be a common cold. If you hear a child wheezing early, you need to go to the doctor. But make sure your child always gets his inhaler. And please get a spacer, which makes the medications delivered to the lung more efficiently.
Okay.
Some of us do. I can't do the coordination that the puff takes, right? And I'm not so dumb. So it's hard. You can ask a child to hold your breath, blow out your air. Okay, you puff. Take a deep breath. Hold it. No, the coordination is too much. If you have a spacer, it's an apparatus that you put over the child's nose. And it's like a bottle, and in the end of that, like a cylinder, and in the end of it, the little thing, it's not big, it's like a drink bottle, okay? Mm-hmm. And at the end of it, you have the inhaler, and you do the 2 puffs into this chamber, right? And the child just breathes it in and out and in and out and in and out for like 3 to 5 minutes. By which time the medication would, get the medication into his respiratory tract. And big people too, trust me, it's a lot easier than trying to use an inhaler. So.
Okay.
Things like Symbicort Symbicort comes in a different presentation. So with Symbicort, you just have to, and it goes into your lung. If you're using Symbicort after you've done that, please rinse. If you're using a brown inhaler after you've done that, please, gargle some water so that the steroid does not remain on your throat and could cause you to have thrush. So,
okay,
if you're using an inhaler that has steroids, please make sure and even get them to drink some water, at least after eliminate it.
Right. Influenza. We hear quite a lot about that. The flu.
So influenza comes in influenza season, flu season, okay?
Right. Uh-huh.
And that's different. There are a lot of, every year you're going to find a new or a different virus. Some predominate. The people who do public health research tend to figure out what the viruses are, because that's their job, right? To figure it out. That's their job to. I'm sorry. That's their job to figure out what it is, which virus it is. But it doesn't matter, because viruses respond to no antibiotics.
Right. But okay? quickly, there's a difference between the flu and the common cold.
Yes.
Right.
The flu is a little more. Causes more generalized illness. It really makes you sick. The headache, the general malaise, the tiredness, I don't have any energy, the joint pains, right? The flu, you will know you have the flu because it will put you down.
Okay.
Especially when it comes to the muscular aches and pains. That's the difference. Common cold, you may have a little pain, but with the flu, you're very ill. You really feel very ill. remember, it is still virally done, so you really just want to take symptomatic medication, Tylenol, Panadol. Tylenol, Panadol, don't take anything else, okay? Because remember, it also presents as just as dengue. And dengue is a disease that can have hemorrhage related to it. So you don't want to take Advil and ibuprofen and those kind of medications, Voltaren and Cataflam and those things, and diclofenac, which is, I'm just saying names, some of them are just the same person with a different name. You don't want to take those NSAIDs because they can make you bleed.
Okay.
Mm-hmm. Okay. And so
that's if you have the influenza. That's if you have the flu.
If you have the flu, yeah.
Right.
But no, don't take anything if you don't know what it is, because usually when rain season come, mosquito season too, and we see an increase in dengue, and we still have chikungunya that lacks around, and we still have Zika that's around. We know endemic. There will be every so often you probably see a case or two, right? Endemic means that you do have some of the condition existing in the country, but nothing to cause alarm. Okay,
right?
It's there, right? The causative agent, the bacteria or the virus exists in the environment. It may appear in somebody who has a condition, and we're going to talk about that after, who has the possibility, the propensity that kind of lean into. You may have a debilitating disease like HIV or something, right? But endemic diseases. Remember, we had a pandemic with the COVID. It means that all over the world, and you can have an endemic outbreak, like we can have in La Mode. We can have a whole lot of people who have a certain strain, okay? Or if you have it over a large area, like the whole country, you can say we have an epidemic of this virus, right? Caused by the flu caused by this virus, but goes, spreads to the Caribbean. When it spreads in large geographical areas, then we say we have a pandemic. So we do have some of those viruses. But guess what? I can leave. I want to say somewhere far. I have to go South Africa and be here tomorrow morning, afternoon. Okay, and somebody on a flight has a flu, and they don't even know. Especially people who are asymptomatic that spread what they have. Or someone just thinks, it's a little cough. Oh, it's my asthma. And I get a virus and I come and I share it with you guys. All right? We travel a lot. Travel is one of the easiest things that we do. And so what is the one place you have to look for it everywhere else, because people are on the move. All right? And so that, you remember how COVID spread? One city in China, and then the whole of China, and then went to Europe, and then it went to the US, and then once it reached America, we're gonna get it, right? So, and because people are moving, if you keep people, remember we didn't have any COVID once we were all quarantined and staying in place. Nobody had COVID. Once we went and play carnival, and we mix up with who have it, and we go back to our houses, we take it like when you put roach bait. The roach goes out, gets it, and walks into the nest with it and kills off everybody else. So we have to be very careful, and we have to protect both ourselves and the people. And it's very important because with the flu, if you're very prone to getting the flu and the bad flu, there's flu vaccine, and the vaccines usually kind of match whatever viruses would come in the season. And I have friends that who take it because they're diabetics or they have heart problems, and they take their flu vaccine and they don't get the flu, because if you have debilitating diseases that can make you ill, weak, like diabetes, hypertension, kidney problems, heart problems and stuff, you don't want to get something like the flu that's going to challenge your immune system, or HIV, right? You don't want to get something like the flu, because it means that you can have more serious experience, I want to say, of the flu, right? So there are populations that we will encourage to take the flu vaccine, and the flu vaccine is free. You go to the health center and the nurse will give you a flu vaccine if you're prone to getting the flu, right? Because one of the things we tend not to think about with sickness is how it affects our economy. How does it affect the economy? If three of you working in an office, in a production line, whatever it is, okay, and one of you is sick, that decreases output, doesn't it? It decreases productivity. And if you have to take 6-8 days off because you're so very sick, right? Imagine. And you still have to get paid. Well, and NIS will pay you for during your ill time. But I'm saying productivity decreases. How is the economy affected? And so I believe that are things we can prevent, that we should prevent them. Okay? I'm sorry. That we can, that we have the probability of preventing. Okay? So that's the flu. The flu would make you sick, just like how, just as how dengue and other things would make you feel very ill. Yeah.
Okay, lovely.
Let me tell you something. You know, we live in our homes and we tend to forget that it's important that, yes, you need to have caregivers, but we still have to take precautions. If somebody in the house has the flu, I hear people say, boy, I have the flu, the children go get it. I know my children go get it. Or my child had the flu, I'm going to get it. No, you don't have to. You know, take the same precautions, wear your mask, and you want to be well if you're the caregiver, don't you? You don't need to be sympathizing with your family who has the flu in that way. They don't need that kind of sympathy. They need you to be well and to stay, right? The other thing is that if your children have a cold, keep them home, please. You don't want to spread it among the population because children are very intimate. They love each other. They hug up their kids. They eat from the same bowl. They share food. They share a corn curl, you know? So yes, it's very close. Mm-hmm. And usually that's passed on by droplets from the respiratory.
Yeah. So we're moving on. Bronchitis.
Okay. So for me, bronchitis is a complication of simpler respiratory tract because, you know, talking about down in your chest, right?
Yes. Uh-huh.
You know, talking about, so you have the trachea and then you have the two big bronchioles and then you have smaller bronchioles, right? Bronchitis
what we usually call the windpipe in common terms. Yeah.
That's the trachea, the windpipe, and then it divides and it divides. Mm-hmm. And bronchitis is the inflammation on the bronchi. Right. Those are the ones that hold up the lung. Okay? Mm-hmm. Now, one of the things you get with bronchitis is the cough. Coughing is a symptom that is important because it tells you what state you're in. Coughing is also a mechanism of defense, right? You know when something go down your wrong throat? Yeah. I don't know what.
Well, your wrong throat is your windpipe, you know.
No, because it's your windpipe because it's not supposed to go down that throat. Okay?
Well, that's why it's the wrong throat.
Right. So the first thing you have to do is cough, right? Uh-huh. Because that's the body's normal response to get rid of something that's foreign to it. Okay, so you drink you're drinking juice and you're talking, and you get a little bit of secretions in your throat. It goes down into your air pipe and your airways, and you start to cough, right? So once the airways get irritated, whether it is by secretions that are produced by a bacterial infection or a viral infection, they will become inflamed. Inflammation of the bronchioles is called bronchitis. And we have to determine whether or not that bronchitis is bacterial or viral when we're fixing it. When we're trying to figure out what's going on so we can treat the person. You also want to contain it because you don't want it to go further into the lungs and into the lung tissue, the soft part of the lungs, and cause pneumonia. Right? Because then it becomes even more difficult to manage. And so if you have a bronchitis, you need to get treated. You need to go see something that high pitch. You know something is wrong because it almost sounds like you're beating on one of those rings. You know the triangle. Mm-hmm, mm-hmm. It sounds like that. You get that high pitched cough, and something is wrong here. And the cough, there's nothing that sedates the cough. You drink a little, it's not like it's up here. It's way down in here. And you get or you can get a barky cough, right? When the bronchitis comes on. And like I said, to me, it's usually a complication from an upper respiratory tract infection that it gets down.
Okay, great. So we're getting now into some more serious stuff. Pneumonia. We've heard about this one, and I think we do have an idea how serious that one can be.
Yeah, some people call it pneumonitis, but pneumonia really is just infection in the airways, in the alveoli, it's no longer in the passages. It's now in the lung tissues per se, right? And it often takes up a certain space, and it will increase in the space if we don't if we don't treat it early, right? What do? You go to your doctor asks what's going on, you listen to your chest, you may need to have an x-ray. Pneumonia can make you very ill. One of the things, apart from the coughing and the fever, and you can have shortness of breath, one of the things is the pain when you're breathing, especially if it's closer to the surface of the lung, the outer part of the lung. So when you breathe and the lung tissue expands, there's all this stuff in there that causes the nerve endings to stretch and to be painful, right? You want to do that, and then depends on where you find a pneumonia, you can figure out what the agent is, but that's not something for here.
Right.
So, and pneumonia is something that needs to be treated. Some people need to be hospitalized, especially people who have, again, debilitating diseases. And we always think about the people in the extreme of ages, very old, very young, and of course, people whose immune systems are not so hot. They're compromised.
Right.
So if you have HIV and you get a pneumonia, it really should be under close supervision. If you have diabetes that's not controlled and you have pneumonia, you may have to be in the hospital, because some people would need medications in their vein, intravenous medications.
Right.
But pneumonia can be quite serious and needs to be followed. The doctor sees you, they treat you, and they say, I want you to repeat your x-ray in a month to 6 weeks. Let's see if it's going. And when you feel better, you're getting a little better. The pain is no longer there. You don't feel as tired and all the rest of it. So, and sometimes you can avoid it, sometimes you can't.
Right. And unlike, let's say, the influenza or common cold, it can be caused by viruses and bacteria as well. Yeah.
And other bacteria, other things that you don't know, rickettsia, mycobacterium, which we're going to talk about shortly. Right? There are different agents that can cause you to have pneumonia.
Right, of course. And I don't think we need to spend too much time on COVID-19 because we actually experienced it.
No,
I think most of us can probably give a nice little detailed report on COVID.
Yeah. I never had COVID.
Well, bless you. I probably had it twice or maybe 3 times.
I tend not to get respiratory illnesses. Although when I was a little girl, they thought I had asthma. I had tizic. You know that?
Yeah.
But I think I had epiglottitis. I'd get allergy and I'd get stridor, so I can't breathe and I'd end up in the hospital. But it's all related to allergies.
Right.
But let me tell you something. I get lizard jump up in coconut water. Okay?
For asthma. but doesn't it work? I've heard that's the probably one thing that makes asthma go away, right? You get a lizard and you put it in water.
No, I'll tell you what it is, because we don't use that method of treatment here, we think that it doesn't make sense. So the first line of treatment that we used before we had all these other things, right, was adrenaline.
Yeah.
You know that hormone you have when you get frightened? So we give a patient, take up 16 units of adrenaline, put it under the skin, and give them 8 units pushed. 8 units first and in bolus, right? It's a little bit of thing enough. And then you give them 1 unit every so often, right? And asthma tends to control. No. When you get frightened, don't you release adrenaline?
Yes.
Something frightening?
Mm-hmm. So
what do you think the lizard, when you take the lizard, just you grabbing the lizard at all, must you drop it in a glass of water? Lizard gets frightened, and that's what I think, okay?
So,
and he gives up a lot of adrenaline.
So how we know lizard have adrenaline? Just
because lizard have adrenaline. They have what we have. They're frightened too. You never see lizard run. Is adrenaline make you run enough when you see something dangerous coming? So I believe lizards have adrenaline.
Right. Well, I mean, the truth is, I mean, it sounds fair. I have only
It
heard,
sounds plausible.
I've
It's
only
not something
heard that if you or I've heard people also say that if you fry the lizard and you eat it, it can work as well. Folks, please don't quote me on that. This is third and fourth hand information I'm giving here. So please.
And people who eat iguana probably still have the asthma, okay? So don't think about it.
Yes, please don't quote me on that one. Yeah, so we
I want to tell you though, that's actually not only limited to Grenada, because I've heard other Caribbean friends who actually know about the lizard in coconut water. And I think it's coconut water because coconut water quite palatable. Okay, it tastes nice. You drink it, right? But you could as well put it in ordinary water and you drink that lizard water. Lizard jump and run away. I remember my lizard running like crazy. What's wrong with these people? Right. And the fight I had to drink the water after. I was a little girl. I was probably like 6.
Yeah. So yes, we did experience COVID, and it's still around. So of course, and
COVID is around, and sometimes we hear outside that that we see an uptick of COVID, or there's a new strain of the virus, right? Listen, people, we learn to wear masks, okay? We know that if you up in people's faces, if you expose to large crowds, right? That you would have the proliferation or the faster spread of respiratory diseases. So I would imagine in places like overcrowded overcrowded jails, nursing homes, daycare centers and stuff. A lot of these diseases spread faster because you have a lot of people in a small space, right? And you can spread, especially when children don't know how to cover their mouths, right? They don't know how to cover their mouths. And older people just coughing, they can't help themselves, and they coughing and they spread out, and somebody come over them and give them from outside, and they have whatever it is. The bottom line is that we need to be aware of the environment in which we are and how prone we are to getting an infection based on where we are.
Right.
Okay. It's funny because I've never had the flu, and my friends will all laugh at me. I remember one time, everybody else in the town have the flu except me. Nixon, I just don't get it. I have other things that I get.
Something probably wrong with you. You're supposed to.
No, I don't get flu.
You're supposed to have the flu. I think everybody in the world probably have the flu. I mean, when I say the flu, the common cold, because we usually use and that's why I ask about the difference, because it is different. Different. But usually once you get stuffy and so you say, well, boy, I have the flu.
No, and I tell you, allergies. Not even that I have. I've probably had flu-like symptoms once or twice for like a day in the last 10 years.
Interesting. Interesting. So, right.
One of the things they said when COVID came, and I don't know what level of truth is there. In years gone by, we used to get a BCG vaccine against tuberculosis. It doesn't happen anymore because there's been control. We're going to talk about that after, because I'm sure people want to hear what we have to say about that.
Yes.
And the people who were researching, the researchers, the scientists managing COVID, mentioned that people who had BCG did not develop COVID. And I guess BCG was not a very specific test. It did prevent you from getting TB, but it wasn't just for TB, specifically. I think it was just very sensitive to major lower respiratory tract challenges, right? But it was not specific for TB. So I think that is why if people who had BCG vaccine didn't get COVID, I think that might have been the reason why. Non-specific vaccine, but sees a stranger coming and jump up and beat it down.
Right. Well, I don't think whooping cough is very much controlled.
No, we don't have whooping cough. We shouldn't have whooping cough.
We still do.
We should not have whooping cough.
Right. Okay.
Because our children are vaccinated.
Right. What about the RSV? In fact, I heard about it not long ago in the U.S. There was a number of cases.
Yes, there was that virus. And it's funny because RSV tends to affect mostly children.
Yes,
But
you're correct.
last year we had RSV, respiratory syncytial virus. That's what is RSV, right? And it can cause severe illness, bronchitis, pneumonia, all those virus can cause severe illness. And remember, if you have a bacteria, you could always use an antibiotic, right? And try and eliminate it. Virus will sit down there until it, 3-4 days gone. But sometimes there's so much other inflammation and damage it does. It takes a much longer time.
Right.
People will tell you, for example, they got the cold, or they got like the common cold, or they got the flu with a chesty syndrome, and they will tell you that they've been coughing for 6 weeks because whatever that virus is that gives you that thing causes so much irritation of the bronchi, the trachea, the two bronchi, the bronchioles, and people are persistently coughing because that irritation remains.
Right.
And sometimes you need to use a steroid inhaler to control it. Some people just, do other things, but use a cough sedative. You really just need to get rid of that inflammation.
Right.
RSV can be difficult, and it tends to happen in newborns in particular and young children.
Yes.
Okay?
Yes.
So that's something that the pediatricians, the neonatologists would look out for among their babies. You have a baby who comes in a day or two, he gets flaccid and he having difficulty breathing and stuff. You would think of RSV, all right? But that is a thing that's mostly managed in hospital, all right?
Right. Yeah, actually, I the first time I heard about it, I think it was maybe sometime last year.
There was
in the US, in the US, yes. I didn't, it was fairly new to me. Then I heard all about it. So, Doc, we're getting to the one I think that most people want to hear, and it was in the news this evening. Tuberculosis. There's been some confirmed cases in St. Andrew. So let's talk a bit about that. In fact, I saw a release that the ministry did put out, where in Grenada we usually get about 3 for the year, but already there are 3 cases. Let's talk about tuberculosis.
Okay. So first of all, I want to tell people, do not be alarmed, because if you are alarmed, you're not going to be able to think of what should be. Tuberculosis is a disease that we had a lot of in the past, okay? And remember we had the sanatorium, the one down behind the sanatorium down behind the fort upon Richmond Hill.
Yes.
Right? And that's where we isolated people with tuberculosis. 1, because I guess we didn't understand it as much. 2, because the treatment of tuberculosis took so long. Right? And it still does. 6 to 12 months of medication.
Yes.
Right? Unfortunately, or maybe luckily for us, our patients still respond, because that's endemic TB. That's TB that has been around. So the bacteria that is causing the Mycobacterium tuberculosis, that's what it's called, right? That's the name of the bacteria that causes tuberculosis, Mycobacterium tuberculosis. It's probably the same bacteria we've had here in Grenada, because I know that in other populations like Central America, the Far East, the Middle East, the Far East, Asian populations, right? They have a lot of TB. And unfortunately, even in Latin America, you have treatment-resistant TB, and that's a big problem. The Ministry of Health is armed, the Public Health Department is armed with one tool, that of contact tracing. So if I have TB, they will come and figure out, where have you been in the last month? Okay, if my thing just show up. Where have you been in the last month? But I have to be sick, because there's a thing called latent TB, that if you don't have symptoms, you can't infect anybody. You have to be sick. You have to have the cough and the fever and all the rest, but we'll come to that. So the Ministry of Health, and because I'm trying to dispel the fear that people may have, the Ministry of Health has a responsibility to tell the public what it encounters, okay? We had all but eliminated TB, because you can apply for elimination. They allow you to have 2 to 3 a year. But when 3 happen in the first 2 months in a year, you're like, what? You understand? It may still be only 3, but you don't want to say, let me see what happens for the rest of 2026. All right. So the ministry has a right to tell you. The ministry is not trying to create panic. I want everybody to know that. This is not to create panic. This is being responsible and saying, here is what we found, and here, and this is where we found it, and we're doing contact tracing. So I have TB. I have a husband and 3 children. They come and everybody has to be tested. My mother-in-law and my mother, wherever I go, the people who I've been in close contact with, my office, let's say I were a school teacher, I would expose most of my children, right?
Yep.
I work in a bank, maybe not to the customer who comes, but the people behind the thing. I work in a call center, okay? So they do contact tracing, who are all the people, and they test them. Who do they test for TB? Well, first of all, I have to have active TB for them to test, to think that I will infect. I have the possibility of having infected or to infect other people. All right, the cough, the chesty cough,
sneezing, yes,
the fever, especially fever that comes at night and disappears. You may have weight loss and fever that comes with a lot of sweating in the night, nocturnal sweating and fever. The sputum that comes up yellowish, kind of yellowish, creamy yellow, right? You might have some pain in your chest, right? You might have lymph nodes if it affects the lymph nodes, but you would have symptoms, okay? And the symptoms are what we use to say this person has active TB. Plus, so that what would they do? The first thing, you have to have some index of suspicion. You have to say, I mean, I've been talking to a young friend of mine overseas who's been having this nocturnal cough, and he's asthmatic. So they're thinking it's asthma, and he's been coughing for 6 years. They've been coughing for 6 weeks. You need to get a chest x-ray. Well, he had a chest x-ray. He couldn't show me the results. I said to him, but you're coughing for 6 weeks, and you've been taking your asthma medications. So you need to go do a TB test.
Mm-hmm.
Really? Uh-huh. And guess what?
It's positive.
So the rule is, and a lot of our doctors don't do that, the rule is if a patient has had a cough, a chesty cough, for 2 weeks, you are supposed to do a chest x-ray.
Right.
Especially because we live in an endemic area. We know that it's around. It may not be all over the place, but you don't know who has been where. Okay? The rule is you should do a chest x-ray. And if the person has TB, usually you see the shadow up on the top of the lung. Okay? All right? That's where the most oxygen is, and it wants it. It wants all of it. All right? So it is very specific where you would see the shadow. All right? And I wish my colleagues and I wish my patients, the people who are listening to us, if you've had that horrible cough and the fever, and nocturnal fever and stuff, ask a doctor to do a chest x-ray on you, to get a chest x-ray done, to indicate an x-ray. Because it's nice knowing, and you could go to the health center and get a tuberculin test. A tuberculin test is really a test to see if you have any antibodies, okay? Those of us who have had the BCG vaccine, remember I talked about the BCG vaccine that prevented TB? Will have antibodies, but the size of the lump that comes up after the nurse sticks you, right? The size of the lump that comes up is smaller than the person who has active TB. Okay? So you do a tuberculin test and you go back in 48 hours, 36 to 48 hours, and nurse looks at it and she knows how to interpret it, and she say, oh, we think you have active TB. All right? Or not. Oh, but you've been vaccinated. Or were you vaccinated? All right? So that's one way. They can do blood tests to look for, like the young man did, to look for the antibodies in the bloodstream. I'm trying to remember. But certainly those three things, right? I just said, and you can do a sputum. You can ask the person to give a sample of sputum in a sterile bottle and to see if the bacterium will grow in the lab. Okay? So those are the 4 ways we can determine. And I'm going to come back to COVID because COVID has taught us how we can prevent respiratory diseases by simply wearing a mask. It's a little uncomfortable, but when you think about how uncomfortable it is not to be able to go to work for 6 months, or to have something like TB that still has stigma. It shouldn't have any stigma. It's just another disease that we want to take care of, that we want to eliminate, okay? And I'm not asking you to run if you have a little cold, right? But you need to wear a mask. When there's a lot of colds going around, wear your mask because that's your way of protecting yourself. All right, let me tell you a thing. Who will get TB? TB is an opportunistic disease, right? In other words, it's waiting for you to get weak. So if you already have HIV or you have cancer and you might be on chemotherapeutics where your immune system is really struggling, children under 5 and the elderly, because the immune systems have its own challenge, people in kidney failure, people who are in overcrowded areas, people with malnutrition, and people like doing IV drugs, right? Their immune system will also be affected, right? And we talk about immune compromise. So if you have other things like other cancers, malignant disorders, and people who have immune problems otherwise, like lupus and other diseases that come with a lot of immune challenges, you're at greater risk. And so you should really be aware. And I will tell these people, wear your masks from now. Not that TB is widespread in the community, but if you're concerned, there's nothing wrong with wearing your mask. As a matter of fact, that's how it also prevents yourself from getting the TB. It's not easy for you to catch. It's difficult to catch. And like a lot of the population who gets the bacteria will actually not have symptoms. So they have latent TB and they cannot infect you. Only somebody with active TB can infect somebody else.
Okay.
Okay. So, can it be treated? Yeah.
But Doc, just before we go to the treatment, a quick question. Can TB move from the lungs to other parts of the body?
Yes, TB can affect other parts of the body. It can affect the lymph nodes. It can affect the bone. It can affect the intestine. It can affect the kidneys. So you can actually find TB there. When you have active TB that's not been treated properly, it can migrate. It can go to the brain. Okay? So it can migrate to different parts of the body. So that's why it's important for us to diagnose. And diagnosis is not death, right? Diagnosis is not a death sentence. Diagnosis is really preserving you and the family and the people who are around you, right? And there is medication. We still have, our TB still responds to the medications that they've had. It's long-term medication, it's like I say, 60 months to 12 months. And when you have, if you diagnose with TB, you get regular chest x-rays, you have follow-up, right? There's a protocol by which people who have had TB, you might have to be isolated a little from your family, but there is a protocol of therapy that could make you better. We're talking.
I'm asking because we have a culture in Grenada when it comes to illness, except in cases where it's chronic conditions. We feel unwell and or we start coughing and we have this maybe cold-like symptoms, and then we decide, rather than going to the doctor, I'm going to go and get some bush, and I'm going to go and do this, and I'm going to do that, and all of the thing. And while we are doing that, we do not realize the danger that is happening, you know. So I'm putting that out there because people need to pay attention and sometimes listen to our bodies, you know, because it does speak to us, but we don't listen sometimes. We just pass things off as normal, you know. So we get these coughs and we get these little things, and then, you know, we don't pay attention. But
and that's a very good point. If you don't know, figure it out from somebody who knows a little better. And I hope my colleagues will take on the responsibility of making sure that patients are appropriately investigated and diagnosed, right? And I trust my colleagues to do that. Right? That's our responsibility. That's why we're here. If you work in people who are in a prison system where there's overcrowding, you know, everybody up close to each other, you can't avoid because they're in small cells, all of that, right? And we know our prisons are a little overcrowded. People who live in barracks, and there's a lot, you know, kids go off to camp and they're living on a campsite, maybe a small house with a lot of kids, right? And we talk about children in daycare, but people are incarcerated at a special, and nursing homes, people are incarcerated at a special risk because you may have people already who are, because of their lifestyles, who have diseases that can be transmitted by droplets, and you have nowhere to go. You have no space to move to, right? You're really limited. So people live in barrack situation who have limited space, where there's overcrowding and you're up under everybody. In particular, when you start having a cough, it may be necessary to get yourself properly treated. Okay?
Right. Let's talk a bit about the ages and how it affects people. Infants compared to, let's say, teenagers and then adults.
So infants, because we talked about it and we glossed over it. The younger you are, the greater the risk of getting diseases, severe diseases, because the immune system is so underdeveloped. Okay? You don't want your granny with TB to come look for you and cough over you once. Okay? Because your poor little lungs can manage this. So children under 5 are at greater risk, and people who are older, and I said older, especially if they have other diseases like hypertension and diabetes and stuff, and, you know, cancers and all the rest. But the older you are, again, the risk is as high as being very young. So the extremes of the age range, right? The extremes of ages are the people who are likely to develop these contagious, because it is a contagious disease. Not everybody will get it. Not everybody will get sick, but you get it from somebody else and from the droplets.
Right.
That they cough.
And again, I just want to add here that, because we mentioned earlier, I asked about asthmatics and the common cold, and they should be, of course, a little more careful. In the case of asthmatics and TB, they need to be even more careful.
Even more careful.
Right.
You already have an underlying disease of your lung. If you have lung cancer, if you have cystic fibrosis, those diseases that are related, are related to the lung. Allergic bronchitis. They may not have full-blown asthma, just may have a bronchitis that comes on very easily. So do we treat? And why do we treat? Why do we do contact tracing? Let's go there before.
Yeah.
So contact tracing is really to protect the people who are the unsuspecting citizens, right? So if you come to my shop and I have TB, and we come and you try and buy the ounce of butter and blah, blah, and we chat and I cough a little, and you go to your house, right? And then you hear a week or two later that I have TB, you really should be treated because you have been exposed, okay? So, and a lot of people would not know that they've met people. So I want people to take this in good stead when the ministry says, Miss Jane or Mr. Tom, you have been exposed to TB because X person came to your shop, or you guys were in church singing a choir together. Do you understand? You're driving a bus with him every day, blah, blah, blah. and of course the family. So people who don't think that they're exposed, when the ministry comes and asks you, please say, look, we found that John Doe has had TB and you know him, you guys play dominoes together, we're going to have to check you. You understand? So please, I'm going to ask people to cooperate because it's in our interest. It's just ready to protect the people who have no suspicion that they could have had TB. They don't think that they've had any, exposure. Do we treat? Yeah. There are medications, but like I said, it's long-term medications. And only the people with active TB are treated. Rifampicin, isoniazid, and those are old medications from a long time, okay? But you have to take your medications and do your blood test to follow up to make sure everything is going on well with you, okay? That's what it is. But I want to ask Grenadians, people here, please don't panic. Just be very aware that it's there. I think it's in St. Andrew, they found 3 cases.
Yeah.
And they kind of know where those 3 cases may have come from. I'm not going to disclose this, but it's right to do contact tracing, right? If a child in your class has had TB, teacher, you're going to get checked, okay? Or if it's, you understand? If the teachers had TB, mothers, you and your children are going to get checked if you've had contact. And that's all it is about. It's really about preserving the lives and the well-being of the people who may have been in touch. Just like having a sexually transmitted disease, you have to do contact tracing. All right? That is how we're gonna.
Well, I think we heard about contact tracing with COVID.
With COVID,
yeah, it was very, very, very common during the time. People had to know exactly what was happening because that's how it was spreading. So it's important.
So we treat also. Why do we treat? We treat to control that that active TB, right? And eradicate the bacillus that causes it's called a bacilli. That kind of thing is called a bacillus. And eradicate the bacilli that cause TB. Right? We have to, and the lung is kind of deep and far, and that's why medications is given such a long time. If when you have pneumonia, you have to take medications for sometimes 2-3 weeks. Yeah. Right? Before you can. And TB tends to be
longer.
Yeah, and it tends to like to stay inside up here where they have all this oxygen up there. The bacillus loves that environment. And remember that if you have a disease that predisposes you to getting TB, like something that's debilitating, you have it anyway. So it's between keeping you well and fighting off that bacillus. Do you understand? Because it's there and it's in you because it likes you, because you're weak. Okay? Your immune system is weak. It likes you. So you're going to have a fight. And that's why the treatment has to be so long.
Right.
So we have gotten to a place where TB is really just it's not a big problem. But I think the ministry is correct to tell people, because we migrate a lot. We go, when I say migrate, in St. Andrew today, everybody have car, you're going in town tomorrow, you go party here, you do all, we go from pillar to post. So we must be aware. And each person is responsible for his own wellness. And so I will tell you, if you work in among large populations of people, you're a bus conductor, you're a driver, with people coming and go out and they cough and nobody pay attention to it, wear your mask. Protect yourself.
Right.
And if you smoke also, you're at greater risk, because already you have broken down, if you smoke, and that includes marijuana, you have already broken down the immune barrier of the lungs by inhaling something as toxic as a smoke.
Yes. Also, misuse of alcohol. That too.
Misuse of alcohol. Yeah. Well, that would make your immune system very weak. So, but let me tell you something. There's no use of alcohol, okay? Because everything is misuse. Even if you have 1 drink a day, the risk. Alcohol is not considered such a high risk for disease that even having 1 drink occasionally is a challenge.
It is.
Having any amount of alcohol becomes a problem for us. we kind of need to recognize also, we must always remember, in the context of Grenada, we must remember that we have, we don't have a lot of resources, right? And that's why public health has to be very active. Public can't stop the 3, but we can stop the 300. You understand what I'm saying? By doing proper contact tracing, by educating John public. I expect the ministry is going to still come out and do some education after this, but we all have responsibility to stay well and to prevent it as far as possible. And like I said, please cooperate if you're asked to do a contact tracing, because you don't know with whom you have come in touch.
Right. I just want to just quickly go over, because we're getting close to wrap up time, the symptoms of active TB in the lungs. So it usually begins and worsens over a few weeks, and they may include cough, coughing up blood or mucus, chest pain.
Including blood
yes.
and yellow sputum.
Yeah, chest
Lots
pain.
of sputum, right.
Pain
chest
with...
pain, it's closer to, yeah.
Yeah, chest pain with breathing and coughing, fever, chills, night sweats, weight loss, not wanting to eat, tiredness, and generally not feeling well.
Well.
Yeah, so these are some of the...
And the weight loss is one of the significant things, huh? Weight loss is very significant in persons with TB. You lose weight like you had a cancer.
Right, yeah.
But looking for that night fever, because that is the telling thing. That nocturnal fever with this cold, with this sweating profusely like you're in menopause.
Yes, indeed.
Okay, so look out for that.
And also active TB. So active TB disease in the voice box is outside the lungs, but it has symptoms more like disease in the lungs. So for example, common sites for active TB outside the lungs, and we mentioned them just going over: the kidneys, the liver, fluid surrounding the brain and spinal cord, heart muscles, genitals, lymph nodes, bones and joints, skin, walls of the blood vessels.
Bones.
Yeah. And voice box, also called the larynx. So these are some of the areas. If it's not controlled, it can spread.
It's not treated, right?
It's not treated. Yeah. So, Doc, let me ask you quickly. So TB moving to these organs, for example, like the kidneys and liver, what damage can it do?
Well, anything that infiltrates any organ will make the organ function badly.
Okay.
Right? So the kidney functions are going to decrease. The liver is you're going to have challenges with whatever. It depends on how it manifests. You might get jaundice if you have a tumor, because it will become a tumor eventually, right? In your liver, your bones will hurt. Your bones become very fragile. Okay. Especially, I think the hip and the lower back are where you have prominent. There's a name for it as well, right? And of course, you talk about having challenges around the brain, the fluid around the brain. You have meningitis, and you can be confused, and looks like you have a meningitis, and neck gets stiff. You become very, very ill, right? And you can become unconscious, and you can die.
Right.
So,
and finally, the importance of taking your medication. Because there's a next culture we have. We go by the doctor give us, let's say, some antibiotics. We probably have to take it for 2 weeks. And after we take it for maybe 4 or 5 days, we start feeling better.
Yeah.
And then you cast the medication aside. In the case of TB, let's talk quickly about that.
You can develop the same thing, resistance, treatment-resistant tuberculosis, and we do not want that here. Like I said, we don't want people who walking around with active TB because the medication, they're not responding to the medication. It is a lot of medication, but it's also important that persons who have tuberculosis know that they must take the medication, because it can eradicate the bacillus, get it out of your system, kill them off, and return you to a normal state of health.
That's right.
Okay? We don't want to have treatment resistance because somebody feels I can't take. It is a lot of medications to take, but you don't want to say, and it's a long time. You don't want to say, I'm not taking that, man. I can drink some bush. No, bush is not gonna. Unless you know a bush that you can give to the ministry that is proven, we'll be happy. And then we have a responsibility to ensure that we can say we have eradicated polio. We have eradicated TB, right? Because I know when I was a child, there was a lot of tuberculosis around, right? And I've known persons who have had TB, right? And, some people had to go to the sanatorium because they had TB, right? But we're ahead of that, and we don't have as much TB in our population, just a small endemic population, 2 to 3. I pray also that the 3 that we found would be our 3 for the year and no more. But that's a responsibility that we all have to take on and make sure that we'll do our part to ensure that the TB that we have today is not spread all over Grenada and beyond.
That's right. That's right. So, Doc, that's all the time we have for tonight. Any final words before we go?
We talked about it in the beginning again? I don't remember.
We spoke about some of the common ones. No,
before respiratory. Look, the other things are there are lots of mosquitoes, right? There are lots of mosquitoes. So please make sure that you don't get mosquito bites, right? Please take care. Please boil your water as water is getting less and less. Please look at your mental health. Driving on the road is crazy. So I pray every morning before I go on the road, just in case I die. Because the truth is, there are lots of irresponsible drivers. I think there are a lot of people driving under the influence. And I would like us to be very cautious on the road. Don't be afraid to give away your right of way. Do not be afraid to give your right of way away to some fool who thinks he has to fly into your face. And especially since you need your car to go to work tomorrow. Don't let anybody hit your car. There was something else. Right? But let's not forget our mental. I'm really very concerned about our mental health. I also want our population to become very educated about this decriminalization of marijuana. The Prime Minister, the law is saying you can only smoke in your house, but you don't have to smoke the whole field. Okay? It should be just recreational, but you don't have to smoke the whole field. You cannot smoke in the presence of children. Okay, because you can't have them inhaling all of that smoke into their system and have secondary smoke and damage to their lungs. But please inform yourself. This is not a license to imbibe yourself with marijuana. And for FYI, medical marijuana is taken by mouth. Medical marijuana is mostly taken by mouth. Okay? That which works. Right? So be careful.
All right. Yes, indeed.
There was something else I needed to talk about that I just don't remember.
Yeah. Well, of course, we're here every Tuesday at this time. So, Doc, thank you so very much. I trust that the message got out there. Again, we just want to remind people that there is no need to be alarmed. Just understand the importance of taking the necessary precautions, doing what you have to do. And of course, if the ministry comes around, please cooperate. It's, as Doc said, and let me just reiterate, it's in our best interest. So thank you very much.
The Ministry of Health has an ulterior responsibility to control outbreak of any diseases that happen in the country. They have the responsibility to report to World Health Organization, because that is how the contract goes. That's how the relationship goes. We have a responsibility to protect people in other populations away from us. So we need to figure out we should not be exporting TB. Do you understand? Just as much as we don't want to import people with TB, we don't want to export the disease. The ministry has that responsibility to make sure that this is controlled, and I think they're working very hard. Listen for the information. Listen. If you're told that you need to be checked, just say yes, thank you.
Indeed.
Okay.
Indeed. So that's all the time we have. Thank you very much, folks. Don't forget, you can join me tomorrow at 6 for managing your money. And then later on, Kaiso Talk will be here with you all evening tomorrow. So thank you very much, and do have a good night. All the best.
Night, everybody.
Drug abuse, cancer, measles, diabetes, AIDS,